Okay, hi everyone. My name is Karl Monahan. I am from the Pelvic Pain Clinic. This following video is 5 simple steps to follow if you are suffering with or from chronic pelvic pain syndrome and or chronic prostatitis. So I've put this together as a guidance, as guidelines, as a bit of reassurance, some framework to work towards or from, and a bit of support really. This is not meant to be an alternative to medical care. This is just, like I said, something to get you moving in the right direction, something to make you feel that there is a series of steps to go through in order to manage your symptoms and to get symptom alleviation in the long run. So, my name is Karl Monahan. Like I said, I run and own the Pelvic Pain Clinic in central London. I have a history of pelvic pain myself. Back in my mid-20s, I had a massive infection, epididymoorchitis, where I lost a testicle and had, as a subsequent result, a number of months of ongoing pelvic pain symptoms. I set up the Pelvic Pain Clinic to help treat patients who do suffer from chronic pelvic pain syndrome and chronic prostatitis and other male pelvic pain presentations as well. Like I said, this following video is to offer some basic guidance and reassurance, a framework and support for those of you who are suffering with chronic pelvic pain syndrome or prostatitis, or if you know anyone else, or even as guidance for some of your patients as well. So what we're going to go through here is a bit of an introduction to pelvic pain, some facts, the types of pelvic pain, and then 5 steps to take. We'll recap at the end, and we'll be going for about 25 to 30 minutes. So, let's look at some of the classifications of prostatitis. This was put together by the National Institute of Health back in 1999, and it classifies pelvic pain prostatitis into these 4 categories. Type 1 is acute bacterial prostatitis. Type 2 is chronic bacterial prostatitis. The key term there for those type 1 and type 2 is bacterial. Chronic non-bacterial prostatitis, also known as chronic pelvic pain syndrome, is type 3, and there are 2 types of type 3. There is an inflammatory, easy for me to say, an inflammatory type and a non-inflammatory type. Type 4 is asymptomatic inflammatory prostatitis. Now, as you can see from that final quote down there from Prostate Cancer UK from 2015, types 1 and type 2, that's the bacterial cases, count for less than 5% of all prostatitis diagnoses. And type 3, the non-bacterial type, accounts for more than 95% of prostatitis cases. The presentation we're doing today with you is going to focus on the non-bacterial, the chronic pelvic pain syndrome or chronic prostatitis. Let's look at some facts to give you a bit of background, and then we'll look at some of the classic symptoms. So, prostatitis, chronic pelvic pain syndrome, is guesstimated to affect up to 16% of males worldwide. It's the most common urological diagnosis in men under 50. And the 3rd most common diagnosis in men over 50. It's said to affect up to 50% of all males at some point in their life. So 1 in 2 of us will experience some form of pelvic pain symptoms in our life. And generally speaking, the symptoms include pain, sexual dysfunction, and urinary issues. So some of the urinary issues might be things like increased urgency, increased frequency, sensation the bladder's not empty, nocturnal urination, dribbling, hesitation. Some of the sexual dysfunction symptoms might include premature ejaculation, delayed ejaculation, painful ejaculation, something called hard flaccid. If you're not too sure what hard flaccid is, I've done a presentation on that as well. You can find that on my website, on my Facebook page, and on my YouTube channel now as well. And pain can be anywhere pretty much from the abdomen, lower back, pelvis, genitals, inner thighs, and patients can present with 1 or 2 of these symptoms across the pain, sexual dysfunction and urinary issues, or it can be a whole plethora. a whole collection of these symptoms. Every case is individual, but they are the common locations, if you like, of where the symptoms will appear. Chronic pelvic pain syndrome and prostatitis have greatly reduced, patients have a greatly reduced quality of life, and the distress and difficulties in coping are often similar to those patients that suffer with angina or Crohn's disease as well. So really quite impactful on the individual. Okay, nice little infographic here. Again, just kind of highlighting some of the locations, some of the areas of discomfort, impact on quality of life, voiding problems, that's bladder voiding problems, pain and discomfort, and sexual problems as well. So let's take a look at some of the first of the 5 steps that I'm going to recommend and suggest that you follow or do if you are suffering with any of those symptoms. The very first stage is to seek medical help. I can't underline this enough. It's so imperative to get the GPs, to get the doctors on board with your particular case. And the reason being is we want to rule out any red flags. We want to rule out anything serious. And if there is treatment that can take place, we want that treatment to take place as soon as is necessary. This will also provide you with peace of mind as well. So visiting a gum clinic for STD or STI tests, you can either do this yourself. I guess this depends on where you are in the world, but generally speaking, you should be able to take yourself down to a gum clinic and have the test done yourself. It may need to go through your doctor or GP. It's worthwhile checking with the healthcare in your particular country. But at this particular point, it's always worthwhile getting the doctors involved. Generally speaking, we guys are not very good at talking about our health concerns, talking about our health worries, or even going and seeing the GP or doctor or urologist or specialist about any health concerns and worries we have. We'll often leave them to manifest, sometimes get worse, sometimes disappear. So my first port of call for you, my step 1, is go and seek medical help. Go and get the specialist on board. Stage 2 is to get the tests done and take the medication if they suggest and advise taking medication. This isn't a long-term thing. Sometimes it's just a case of bringing symptoms under control. Sometimes it's a case of taking the medication in order to reduce and obliterate the symptoms in the first place. Now, more often than not, you'll need to get a referral to a urologist for additional testing. Some of the tests may involve some of the following, and the following tests will largely depend on your presenting symptoms, the healthcare in your country, and the specialist training of your urologist. So it might include things like PSA testing, STI or STD screen, a flow test to check for peak flow, rate of flow, strength of flow, and the duration of flow. This is urine flow, by the way. A flexible cystoscopy is a camera that will be passed down through the urethra to check for any blockages and any symptoms, any signs within the bladder itself. You may have a urethral swab and or urethral culture taken, blood test, and this may go beyond just the actual PSA test. Semen analysis, urine analysis. You may get an MRI of your pelvis and or back as well, and ultrasound of your bladder or testicles. Again, it very much depends on where your symptoms are and what your presenting case is like. In some countries, you can get what's previously been known as a 4-glass STAMI test, although the pre and post prostate massage urine sample has mostly replaced the STAMI test. So that's a pre-urine sample and a post-urine sample, and in the middle there's a prostate massage that takes place. You'll need to see a urologist to get these specialist tests done. But once you've had the tests, then it may simply be a case of ruling out anything sinister, anything that needs medical assistance. You may be prescribed some medication. Like I said, follow the course of medication. It's so important that we get the medical world involved with this as well. So, step 1, seek medical help. Step 2, have the test done and take the medication. My step 3 is, if you're not seeing any symptom alleviation, or you want to understand a little bit more around the symptoms and current treatments, then it's to read up. There is a huge body of literature around chronic or persistent pain states, much more so than we've ever known beforehand. Our understanding is so much more advanced now around persistent and long-standing pain states, complex pain states, than it's ever been before. And this is really, really important and also greatly encouraging for recovery, for patients. Be informed. Okay, for me this is essential. It means that you're able to take what's being told to you and assimilate it yourself. By having a greater understanding as to what's going on, then it means you're able to manage and deal with things far more effectively. There are also more books out there about non-bacterial prostatitis other than Headache in the Pelvis. Now for me, Headache in the Pelvis was pretty much the first book I came across. Its first edition launch was the same year that I came down with my symptoms itself, and it was and is still a pioneering venture. However, there are other books around the subject matter now as well, and I think probably books that are slightly better written, just offer a slightly different approach, and again, I think it's important to read around the subject. So, on my website, there is an article I have written that outlines a range of books that are available for therapists and for patients themselves. So if you go to, you can probably see my webpage there, the big red circle is around the articles link. Click on the articles link and go and find the books and the resources for chronic pelvic pain syndrome and for chronic prostatitis. There's a little bit of a brief introduction to each book and the reason why I feel they're really beneficial, and also good reads for you as well. Like I said, it's important to be informed about your decisions and your options ahead of you as well. It'll also make you feel like you've got more options ahead, because one of the worst things about having pelvic pain is the number of dead ends that you may end up experiencing and the lack of options that come out of that as well. So by reading around the subject, I feel you'll be better informed, you'll have a greater understanding as to what's going on with your particular case. On the back of that, and this isn't pelvic pain specific, but on the back of that, I'm going to suggest that we take a look at a really, really great resource being put together by a guy called Lehman. It's called Recovery Strategies. It's a pain guidebook. It's a free download. Again, tick in my box, a really, really good resource. Just need to go to Greg's website here. That's the link at the bottom of that page. And it's an excellent free resource for understanding pain states, complex pain states. It includes strategies and sections to self-complete by you, the individual, the patient. And it describes the reasons why we may end up in pain, what contributes to pain, what contributes to flare-ups, other things that we may not have immediately considered. So for me, it's a great resource. Like I said, it's not pelvic pain specific, but it is complex pain states specific. So I can't recommend that enough. Alright, so step 1, get the medical world involved, go and see your doctor. Step 2, take medication, have the test done. Step 3, read up, be informed. Stage 4 is about finding more specific support for yourself from the specialists that are out there. So find a therapist. And again, on my website, if you go back to the same link, so back to the articles, click on the articles, I'll put together a directory of global therapists that have experience in treating complex and chronic pelvic pain states, specifically in men. So I would suggest finding a therapist local to you, making contact, seeing what the treatments they offer are, see if they're in line with your thinking and understanding. There are a number of therapists out there that offer global support as well, so online or Skype support. So again, it depends what you're looking for, depends how much support in terms of how much individual support you need. But it's a great resource. So go onto the website, click on that particular link, and it will take you through to a directory of therapists across the world. Okay, so final stage, stage number 5, and this is more generic information. It's not specific to an individual, but it's advice that I would give to someone who came to me just saying, well, look, I'm a bit confused as to what to do. Where should I go from here? What should I do? I've got these set of symptoms. How do I manage them on a day-to-day basis? And my key word here is moderation. So moderation is managing the dosage. And managing the dosage of everything that we do can bring down our overall sensitivity. So let me give you a few examples. If you have chronic pelvic pain syndrome, chronic prostatitis, you are in a sensitized state. You've probably found yourself that there are a number of things that irritate your symptoms, that make them worse, that often end up in a flare-up. So this basic bit of advice I'm going to give you now will be a way of managing that, reducing the chances of that, or if you're in a flare-up, a way of taking the edge off of things and giving you back a sense of control as well. I follow a number of forums, I follow a number of chat rooms and Facebook pages around the particular condition. And a question came up last week about a guy looking to go back and start doing squats again, exercise again. And his question was around squats. And he was asking around what should be done, what kind of intensity, repetitions and sets, the frequency, everything else as well. And a lot of the advice came in response to his question was avoid squats, they're the worst thing ever. They will increase your symptoms. Let's put this in context. There are a variety of different squats to do, and some will increase your sensitivity if you're in a sensitized state. But here's the thing, if you sit down throughout your daytime, which most of us do, then essentially you're squatting. It is a fragmented squat. If you sit down from standing and stand up from sitting, you're squatting. Now that doesn't always sensitize us, but going in the gym, getting on the Smith machine, taking the Olympic bar, sticking 80 kgs on each arm and squatting with that on your back, that's likely to increase your sensitivity, especially if you've never done that before. So here's the thing. If you're used to exercise and activity, then moderate it a little bit. Bring down the dosage, reduce the intensity, reduce the duration, reduce the frequency, increase rest times. If you're not used to squatting or going to the gym, now's not the best time to go and do so. If you're not used to drinking caffeine, now's not the time to start going and drinking lattes or mochachinos or flat whites. If you are used to drinking caffeine, caffeine can be quite sensitizing. So I suggest you reduce your dosage a little bit. Reduce the frequency you're having coffees throughout the daytime or caffeine throughout the daytime. If you're used to drinking alcohol, again, alcohol can be really, really sensitizing for us. Most of us know what a hangover feels like. And if we get to a state where we've had enough booze that we end up in a hangover, then our symptoms of pelvic pain are going to be increased, much, much more so. Our bodies are sensitized. Reduce the dosage, and we reduce the chances of ending up in a flared or sensitized state. If you're used to having spicy foods, reduce the spicy foods a little bit. If you've never had spicy food in your life, if you don't like spicy food, now is not a good time to start introducing spicy foods into your diet. Moderation is key. Managing the dosage. Remember, you're in a sensitized state, and things that would normally sensitize you are going to sensitize you a little bit more. So it's important that we do a little less of those things that can sensitize us. So things like drinking, exercise, work and stress. And as much as we possibly can, it's really, really important to manage these. And do a little bit more of those things that are more healthy and will reduce sensitivity whether we have pelvic pain or not. So what I mean by that is increase sleep. Increase our natural foods, not processed foods. Try and eat as many fruit and vegetables as you possibly can. Try and eat organic where possible as well. Increase your water intake, not by litres and litres and gallons, but just a little bit. Again, hydrating the body is really, really important. And increasing time out. Increasing those things that are likely to reduce our sensitivity is a great way of managing dosage. Reducing those things that are likely to increase our sensitivity is also a great way of managing dosage. So my step 5 in terms of managing or what to do if you end up with chronic pelvic pain syndrome or prostatitis symptoms is moderation. Now you can get much more specific recommendations and advice from a therapist. And again, in my step 4 was to go and find a therapist, go and find a specialist. But generic, general, Non-specific advice I would give to anyone asking me questions around their pelvic symptoms is to moderate everything. So let's go back to step one again. Step one, go and see the doctor, go and see a urologist, go and see a specialist and get the test done. Step two, take medication if and where appropriate. Step three, read up and around the condition. And like I said, we're in a really, really great situation now. I don't mean, and so it's also really important to highlight here, I don't mean to go onto forums. I don't mean to go onto chat rooms and to support groups and read the information on there, because that can be very misleading sometimes. And what works for one individual may not work for all. And that can be really quite harmful if you try that one solution that doesn't work for you. I'm talking about reading some good literature with some good references and some good resources out there. Find a therapist. Step four. Like I said, there's enough therapists out there at the moment. We're increasing slowly that will offer support and guidance and tailored and specific programs for yourself. And some of them may offer international guidance over Skype or by email, etc. General advice, moderate everything. Reduce the dosage, manage the dosage. To stay away from flare-ups, to manage symptoms when you are in a flare-up. If you have any questions or concerns, or you're looking for other resources around pelvic pain, then you can visit my YouTube channel. There's a couple of videos on there. I'll be doing much more through 2018. You can follow my Twitter feed or my Facebook page. And then if you have any questions or queries, do feel free to email me, karl@thepelvicpainclinic.co.uk, or you can visit my website, again, for other additional resources. That's www.thepelvicpainclinic.co.uk. So don't despair if you do have symptoms of chronic pelvic pain syndrome or chronic prostatitis. There are options available for you. Follow these 5 simple steps to get you moving in the right direction, to give you some guidance, to give you some support, and to give you a bit of a framework to work towards. I hope you've enjoyed the video today. Come back and visit me on my website or my YouTube channel for more references and resources. Thanks very much. Take care.